Flexor retinaculum or carpal tunnel. What it is? Flexor retinaculum is a strong fibrous band formed by the thickening or modification of the deep fascia, acting like a tie beam and converting the anterior concavity of the carpal bones into a tunnel, and that tunnel we call it as carpal tunnel. If you see here, these are the carpal bones of the right side which are concave. Here you see it is concave. So the deep fascia over here forms a band like this and converts this concavity of the carpal bones into a tunnel, and that tunnel we call it as the carpal tunnel. Okay. Boundaries. So medially, now this is our carpal tunnel. This is the tunnel, or this is the flexor retinaculum which is forming the tunnel. Medially it is bounded by pisiform bone and hook of hamate bone. Okay, these are the medial boundaries. This is pisiform bone and hook of hamate. Laterally, tubercle of scaphoid and crest of trapezium. So medially to pisiform and hamate, laterally to scaphoid and trapezium. It is connected. It is having an extensions, like along the lateral side, a deep slip is extending like this from the retinaculum to the groove present on the trapezium, and this slip forms an additional compartment through which flexor carpi radialis muscle passes out. Similarly, along the medial side, a superficial slip extends which converts this region along the medial side into a canal called Guyon's canal, and that superficial slip may be also called as volar carpal ligament, and through that canal, this one is the ulnar artery and this ulnar nerve passes. It's clear. Now coming to the structures which are passing superficial to this flexor retinaculum. Number one, that means the structures which are passing superficial to the retinaculum is palmaris longus muscle, this one palmar cutaneous branch of median nerve, this is a median nerve, and this one is a palmar cutaneous branch of median nerve which passes superficial. This one superficial palmar branch of radial artery, this is a branch, superficial palmar branch of radial artery, and similarly here palmar cutaneous branch of ulnar nerve, palmar cutaneous branch of ulnar nerve, and even this ulnar nerve and vessels, and even this ulnar nerve and vessels. All these are the structures which pass superficial to the flexor retinaculum. The structures which pass through the carpal tunnel or which is passing deep to the flexor retinaculum are, this is important, this one is median nerve, the main important structure being the median nerve, 4 tendons of flexor digitorum superficialis, these 4 tendons of flexor digitorum superficialis, similarly 4 tendons of flexor digitorum profundus, this one flexor pollicis longus, and this one flexor carpi radialis. I repeat, the structures passing through the carpal tunnel are median nerve, 4 tendons of flexor digitorum superficialis, 4 tendons of flexor digitorum profundus, flexor pollicis longus and flexor carpi radialis. Now coming to the bursa in relation to the carpal tunnel R. We find two bursa here. Along the lateral side, this is the radial bursa which is present around the flexor pollicis longus. This bursa we call it as radial bursa, and similarly along the medial side, the bursa present around these 4 tendons of superficialis and profundus. This one we call it as the ulnar bursa. These are the two bursas which are in relation to the carpal tunnel. Now coming to the applied anatomy or clinical aspects. Compression of this median nerve within the carpal tunnel is called carpal tunnel syndrome. It is called carpal tunnel syndrome, characterized by wasting of the thenar eminence, tingling sensations and numbness across the lateral 3.5 fingers, median claw hand deformity. All these are the features related to the carpal tunnel syndrome. Now, what are the causes of the carpal tunnel syndrome? That means what causes carpal tunnel syndrome? Etiology. So, for that you need to remember which structure is getting trapped because of the entrapment of the median nerve. The syndrome is resulting. So, try to remember a mnemonic median trap. Okay. Now, the causes of the carpal tunnel syndrome are M for myxedema, E for edema, D for diabetes mellitus, IA for idiopathic acromegaly, N for neoplasms, T for thyroid disorders, R for rheumatoid arthritis, A for amyloidosis, P for pregnancy. So, these are the causes of carpal tunnel syndrome. Now, coming to its treatment, with rest and with usage of some sort of splints around the wrist, a minimal carpal tunnel syndrome can be treated, but when the symptoms are very vigorous, it requires surgery, that is the decompression of the median nerve. It is a surgical procedure. So, this is all about the flexor retinaculum or carpal tunnel, which is very important for you in your examinations. Thank you.